couple decides to start a family, the expectations are usually very high, including addition of children to that family, which come with a lot of, or which brings or changes everything for that family and alters all aspects of life for that particular family. But when that family is not able to add offspring to their home due to infertility, then a lot of stress and blame games begin to creep in simply because it's not possible. Now, what causes infertility? And what is actually infertility? Today, that is our topic of discussion, and we're going to look at all aspects, all there is about infertility. And in studio, just the way we promised you last week, that in a couple of months, we will be focusing every Wednesday right here on My Doctor Show. We will be looking at pregnancy all the way from conception till delivery. And we are still talking about conception. That's why today we are talking about infertility. So we have special experts here in studio today to just tell us what infertility is, what prevention measures can be taken, and what possible solutions do we have or treatment options do we have for infertility. You're always welcome to be part of this show by maybe calling in or even asking a few or sharing with us your comments. The SMS line is always 20268, and the call line will always be displayed right on your screen. On Twitter, we are at Ebru TV Kenya, and the hashtag will always be My Doctor. You can simply talk to us through our Facebook page at not at, but Ebru TV Kenya, or simply talk to me directly at Purity_Museo on Twitter and Purity Museo on Facebook. But before we get into a discussion, as usual, we want to look at what's coming up. My name is Purity Museo, and this is My Doctor Show.
I'll just start by saying what ovulation is, which is when the egg ruptures and it's the optimal time to get pregnant. It's quite difficult, to be honest, to monitor your ovulation. I will tell you that. Some people might have a little pain on one of their sides at the lower abdomen. Some people have a mucus that is from the birth canal that is light and watery, and that tells them that it's the sign. Some people get moody. So there are different things that would make you think that you are ovulating, but it is not. It's not set in stone. There are people who have no idea that they're ovulating. So to be aware, you can be aware, but not everybody will know. I think that's one of the myths that should be dispelled, because there are very many things that do cause infertility. One, if the man's sperm, if the quality or the numbers are low, you will, even if you're ovulating, you will not get pregnant. So I do like to stress that fertility is a couple thing, and that there are many things that we need to test to ensure that you will get pregnant. That's a difficult question, and the reason I'm saying it's a difficult question is I could have the mucus, but most people don't really look at their mucus and check, or I could have signs that I want to have intercourse, at that point, and that's one of the signs. The mucus is one of the signs, but it also does not mean that it's not obvious to all the people, but those are some of the signs. In some instances, it means there are people who get periods after 6 months, after a year. It means that they ovulate irregularly. That's what it means. It doesn't mean that they don't ovulate, but they probably, if you haven't had a period in 6 months, you may be ovulated at the end just before you got 2 weeks before you got that period, or not. So ovulation is not, it's not I have a regular cycle and I'm ovulating. It's not an obvious thing. Yes, it depends on what is causing the irregular ovulation. So there are some hormonal imbalances that could be at play, because the ovaries are affected by many systems, and if that is the problem, then it can be regulated.
And so what is the normal requirement for fertility, and how much do we even know about fertility? To help us discuss that, in studio we have Dr. Wanjiru Ndegwa, and she will be taking us through that. But just remember that you're welcome to be part of this show by calling us live The number to use is 0791 478 990. I repeat, 0791 478 990, or you can text us. The SMS line is free of charge, 20268. Welcome to the show, Doc.
Thank you.
And thank you so much for making time for us.
Thank you for having me.
Yes, we're talking about something that is really an issue. But before we get into what infertility is, maybe you could just paint a picture of how much is a problem of infertility in the country right now.
Okay, I think that's a very relevant question and something that the audience needs to know, because fertility is on the rise, to be honest. We say that probably 1 in 10 couples are struggling with infertility, or their inability to conceive within 1 year, which is what fertility means. But we have seen over the years that there is an increase in terms of even age. We're getting younger women, 28-year-olds, having problems to conceive, which we were not seeing before. So probably we should take it back and do a study to see whether the levels have risen.
Right, and we talk about infertility. What does it exactly mean?
Okay, what infertility means, that I'm not very keen on that word. I like to use subfertility because it's softer. Infertility means you are not going to be able to conceive, but subfertility means there's a problem, and it means that you've not been able to conceive within 1 year of trying.
Right.
And trying means that you're having regular intercourse with your partner at least 3 times a week, 2 to 3 times a week for 1 year. Then we know, okay, there could be a problem. But it gets a little bit deep, because if you're over 35, then we think, okay, you need to come a little bit closer, earlier. So in the age group of women who are over 35, we want them to, we say could be a problem if they have not conceived within 6 months.
Right, and because you've talked of sub-fertility, do we have different kinds of fertility?
Well, we classify it into female, male, and the couple fertility. That's how. So what infertility means, or it means that, I take it to mean that you cannot conceive. It's an absolute. And these are like either a woman who has no eggs, her ovaries have shut down, or a man who has no sperm. Those ones we have to do other things to help them. But subfertility means that we could do something to help you.
Right. So let's talk about both the subfertility and do we say infertility, completely infertility? Maybe what causes that?
The causes are varied. Mostly for, I would put it at a lump, and I'll take it in terms of female and male. So for females, our biggest problem is tubal factor, which means that our tubes are blocked. Yeah, which means that our egg, when it is ovulated out of the ovary, the tube is the one that picks it up. And if it is not able to take it, and the egg is not able to flow into the tube, and the sperm is not able to enter into the birth canal, into the uterus, and into the tube where fertilization occurs, then, it will not work. So our biggest problem, and something in the range of 60 to 70% of women suffer from tubal disease. So that's number 1.
Right.
Number 2 could be factors affecting the ovary. And that's our biggest problem now is age, because women are waiting longer, want to be more career focused, and therefore we are getting into the 38, 40, 45-year-old when we are still living life. You're YOL, it's called YOL. You only live once, and you're doing your thing, but at 42 and onwards, or even 40, our eggs are diminished, and therefore we are not going to be able to conceive so easily, so we're having trouble with that.
And is this a problem, because there's a lot of stigma that come with subfertility or infertility? My question is it a problem for only females, or there could be something wrong with the males as well?
No. Yes, there is. That's why there is actually male fertility. Right. So for the males, we have a lot of sperm problems, and it's actually thought that probably 50% is the male factor problem. Yeah, but what we see in our society, unfortunately, is it's blamed on the woman. And even when the man has the problem, they do not really accept. A lot of men don't accept. So it is a problem. And the most common cause for that, one is genetics. Something happened and the sperm did not form, or there's no function in the sperm.
Right. So
that's number 1. But also we're blaming lifestyle on a lot of sperm factors. We're drinking more alcohol. we're smoking more, we're taking recreational drugs, so that has an impact on your sperm as well. And even how we're living, we're eating badly, and we don't have enough antioxidants in our food, so that also affects the male as well.
Right.
But the most common is, to be honest, genetics, or if the man had a problem. And this, I caution young mothers to please look at their boys, because some men are born with the testis inside the abdomen, or it's not in the scrotum. And if that happens, most likely we'll have a problem later to conceive. And some people find it out even in the age of 30s, which is very scary.
Right.
That it was not caught earlier on, and it could have been corrected. So that's one problem, and there's another problem called torsion, which happens in the adolescence, where there could be, the sperm could twist on its own blood supply and cut off blood supply, and therefore the sperm function will not
All right, and I can see there are lots of questions that are coming in regard to ovulation. When do we even think of trying? But we will be looking at that later. But before then, Doc, you've talked about age, and you've also talked about genetical. But now for women, studies have shown that in every worldwide, and especially this problem is persisting and increasing in especially developing countries. What is the biggest contributor to the cases that we are seeing right now?
It's tubal disease.
Right.
Yeah. Without a doubt, it is that we are not taking care of ourselves. We're having more, the debut for sexual activity is happening at 14, at 9. I mean, so by the time we're married in our 28 or 30s, we've had multiple sexual partners. We've caught an STI, STD, chlamydia, gonorrhea. It's gone silent. We actually don't know that we even had it, and it's blocked our tubes.
Right.
So that is the #1 cause. But male factor in terms of sperm quality is, I guess, the second.
Right, and today we are talking about infertility. What causes infertility? How can it be prevented? And what are some of the possible solutions for that? Remember, you're welcome to be part of this discussion. You can call us using the line or the number that will always be displayed right on your screen. It's 0791478990, or simply send us a message which is free of charge, 20268 rather, and we will be looking at your comments and your feedback during this discussion. There are lots of questions in regard to when do we try, in regard to irregularity of periods and so forth. But let's still talk about infertility. What are the symptoms? Do we have symptoms for both men and women that when I begin experiencing this kind of seeing 1 or 2 changes within my body, then that's an alarm for me?
Okay, yes, I think there are salient symptoms and things that you should look out for, so that once you get married, you know that, okay, I can't wait forever, I need to go to the doctor sooner. And for women, one is having irregular periods. I mean, if you don't have periods for 6 months or 2 months and it comes, then you know that there probably is a problem with your hormonal balance, and therefore you should see your doctor earlier so that he or she can rectify this and you can easily conceive. I think for women that's the biggest thing, irregular periods. But for men, I mean, I think they do have symptoms. If you notice that one testis is not there, you need to see your doctor earlier. If you notice you're having a problem in terms of ejaculation and erection, you need to see your doctor a bit earlier.
Right.
Yeah.
And from your day-to-day interaction with the patients that you have or you come across, maybe you could let us understand, where are we as a country in regard to statistics? What people are we seeing in terms of gender? Are we seeing more female than male coming for or having these problems, Doc?
The problem is a couple problem. I will stress that it's not my problem. It's not a man's problem. It's a couple problem, whoever has a problem. So in terms of our statistics, we feel that 30% of women have the problem, 30% of men have the problem, 20% it's a couple thing, both of them have a problem, and in 10%, around 10%, it is unexplained, because there are people we find everything is okay, but we're just not conceiving.
Right.
Yeah.
Doc, in an African setting, how do you convince a man that maybe they've come to you, it's a couple for checkup, they've been trying, it's not possible, but we've seen that men, most of the time, they do not accept it. So how do you convince a man that, you know what, you're the problem and you need to do 1, 2, 3, and 4 to change that? Yeah,
I mean, this is one of the tricky situations that we have, and it goes both ways. I won't say it's only men, even women shy away. But I will say that I tell the woman to know her husband. You need to know how to ensure that he comes into the clinic with you. And at that point, we really discuss fully everything that could happen, and we tell them that it could be their problem, it could be the female problem, but at the end of the day, it's a couple problem. And if they really want the situation to go well, they need to have a semen analysis. And some of them do, some of them don't, but I think it's a difficult thing. And what I see sometimes is that they realize too late. Like there are couples who come when the woman is already 43, yet they've lived and they've known there is a problem for 10, 12, 15 years, but they come when the woman now has no eggs.
Right.
And I think that's my biggest, I get very sad at that because they had a chance, but you know, just factors beyond the woman's control or the man's control did not allow them to come in at the right time.
Right.
So I think they need to own their diagnosis. Really, we need to, because there is technology that can help you. You know, it's not a lost case. There are things that we can do. So the sooner we know what's wrong with us, the easier it is to move forward and actually give you the chance to have a baby.
Right, and someone may be asking, because now you've talked about the age bracket. Is it a problem for the old-aged alone, or what age bracket are we talking about? At what age, as an expert, do you advise someone who is hoping to have a child in the future to begin trying?
Okay, well, our grandmothers never had problems, and
Right.
that's because they started having their children at 20. According to our physiology, the best age to get a baby is from 22 really to about 28. That's when you're most fertile. I mean, because women want to be empowered and we're being educated and going into university, it's not really possible. We're taking longer. But I do say that for anybody, because we're also seeing premature ovarian failure where your eggs have failed early. So for anybody who is who wants a family, I think don't wait. Find the man. There's no perfect man, women. I mean, there's no perfect man, to be honest. So find a good man, settle down and have your children.
Nice.
Don't wait. And you can do everything. You can do your masters and have your babies. You don't have to, one does not have to give way for the other.
Right, I think that's quite a good advice.
Yeah.
But Doc, you've talked about age. You've also talked about maybe, let me just bring you back to some statistics that were conducted last year, that STIs, the infections, the sexually transmitted infections, they are the largest contributor to infertility. Maybe you could elaborate more on that, how, and what are other contributors do we have for infertility apart from genetics and age?
Yes, what I was talking about in terms of tubal disease, it's caused by the STI, STD largely. So that means that we have no idea. Unfortunately, chlamydia and gonorrhea can be very silent. You could have a discharge that you're not sure whether this is your normal, it's not, doesn't give you much pain, or it could give you abdominal pain. But women, you know, sometimes we don't really go and check up, or you go to the chemist, pop a pill, and it's not the right antibiotic for what you're having. So STIs, STDs, chlamydia, gonorrhea, TB is also on the rise, will give you tubal disease, and therefore once your tubes are blocked, then we're not able to conceive naturally.
All right. Okay, are you having problems with conception, or do you have fertility issues? Then this is the right show to be watching right now, because in studio we have Dr. Wanjiru Ndegwa, and she is breaking it down for us on what can be done, and she's just told me that there's hope for couples struggling with conception or getting a baby. So talk to us. The SMS line is free of charge, 20268, and the number to use is 0791 478 990, or simply talk to us via our Twitter handle at Ebru TV Kenya, the hashtag #MyDoctor. Okay, Doc, we're still talking about the infection, some of the factors that lead to infertility and so forth. But let's look at this category of people who've been trying maybe for 1 year or for even 6 months and less than 1 year, because you've talked about after 1 year. But what happens in between? You've tried actively tried for 6 months and is not working. Should you still worry?
No, I mean, I think what studies have shown, most people will get pregnant around the 9th month to even, honestly, to the 15th month of trying. So we can assess you, but a lot of couples come, and because now there's all this trend of fertility, people come and say, I've only tried for 3 months. 3 months is too short. And I tell them, you know what? Remove those apps. We have all these apps that are telling us this is the best day. I really don't like them. They give us stress and it becomes mechanical. You're supposed to be intimate with your husband and enjoy it, not be like, okay, it's the clock. Eh?
Right.
I mean, throw the app away, enjoy what you're doing, baby will come as
Right.
long as you have no problem.
Right.
For most couples, within 1 year, you will get pregnant. But if you do see the signs that we were saying, you have irregular periods, you're worried about your for the man, the testicles, or you don't have the sexual, there's something wrong in terms of some sexual dysfunction, then you need to see us. But for most couples, relax, remove the stress from it, remove your app, have a normal, nice relationship. Within 1 year, most of them will come back.
Let's talk about the app now.
Yes.
The menstruation cycle and all that, because it revolves around that. For any woman,
Yes.
they would understand that. So, Doc, there are people with irregular periods.
Yes.
And there are people with regular periods.
Yes.
For people with regular, I'm sure it's easier to monitor their
Yes.
ovulation. But what happens with this person with irregular periods? How do you know when to keep trying or when to begin trying? Because I'm sure you can't keep on trying. Every time there is a time when you get more hopes of getting children. So talk to people with irregular periods,
Okay.
Doc.
I think there are a lot of people with irregular period, and most of them or some of them have something called polycystic ovarian syndrome. And can I just say that PCOS is your friend. Imagine, do not hate it. I have women coming and crying because they have PCOS, but PCOS means you have lots of eggs. So
Right.
you are more likely to get pregnant. So please don't worry about that. In terms of ovulation occurs normally 14 days, yeah, before you get your period. So it's very hard to track. So
Make me understand.
yes, I want you to understand with
Yes.
this. So this board is a normal month.
Maybe
So
you can stand.
yeah, okay.
All right.
But I'll be higher than the board. But anyway,
Okay.
this is a normal month. So suppose I got my period on the 31st of this month.
Okay.
I would have ovulated on the 17th.
How? How do you know?
How do you know? Now, you see, you only can go back with ovulation. That is the problem. The first part of our cycle is irregular. You see, if we took it from here, if you have a 28-day cycle,
Right.
let me just start with that, which means your period comes every 28th day. So it means you had your period here, and the next time it will come is here.
Right.
It means that you will ovulate on the 14th day of that cycle.
Doc, I'm told there's a red mark somewhere. Maybe we can use.
Okay,
It's on top.
a red marker, okay. Yeah. So day 1 of your period is?
Fast.
The first.
Right.
So I have my period, for 3 days there. So it comes here, here, and here. And if you see on that app, then it will start coding for you that you're coming to fertility here, here, and probably here.
Yeah.
Yeah? Most likely day is the 14th day if you have a 28-day cycle. So it really depends on your cycle length. If you are a woman who has a 21-day cycle, you're ovulating on the 7th day of your cycle. It is always 14 days before. It's unfortunate that we can only go backwards, but we can't go forwards.
Right.
So what your app does, well, what these apps do is they try and see what your cycle length is on a regular. So if you have a 21-day cycle, every 21st day you're having a period, you're most likely ovulating on the 7th day. So that notion of 14th for everybody is wrong. Yeah. Some people have a 31-day cycle. So I've started here and my period will come here. It will mean that you
The
ovulated
17th.
on the 17th, 14
days
before.
All right.
Yeah.
And for people with irregular, let's say today I have a 28 cycle and the next month I will have a 31 cycle or even 21.
Yeah.
How do you monitor?
Now, it's difficult to monitor, and even the apps will not be able to monitor that kind of flow. So for those people, one, sometimes if you have very short cycles, we're not sure actually that you ovulated. And I advise those type of people to actually see a
All right.
specialist.
Maybe you can have a seat, Doc.
Yeah. Thank you.
And Doc, still on that, someone is asking, for
Yeah.
example, my periods come 2 days earlier or even 2 days each time. Maybe it's a person who keeps on monitoring her periods. So
Yes.
sometimes they come 2 days earlier,
Yes.
sometimes 2 days later. For those kind of people, when you can monitor the type of irregular cycle that you have, can you still be able to know when you are ovulating?
What I say for those type of people where it's like 2 days, then what you should start having is having intercourse, not on the 14th day, but on the 12th or 10th day. Yeah. So have it a little bit earlier because you expect the period to come earlier. So you're counting backwards. I don't know if you've understood.
Yes, I have. And Doc, there are issues. There's someone who is asking for example, the issue of really bad cramping, abdominal pains.
Yeah.
Is there a problem when, for example, you're having your periods and you're really cramping? Some people can't even walk.
Yeah.
What's usually the problem with that?
Yeah, I think that's a really good question, because we are in the endometriosis month this month, and last week we really had a huge campaign on endometriosis. Painful periods that debilitate you, that you cannot go to work, are not normal. Yeah, so that person needs to go see a doctor. The only problem is sometimes it could be endometriosis, which is a condition that does affect your fertility. So you would need to see a doctor for that. But it could be other things. It could be infection. It could be it could be infection. It could be some other syndromes like adenomyosis. There are many things it could be, but it is not normal, and she should go and have be checked by a doctor.
How about just mild abdominal pains?
Mild,
or any kind of pain is not normal?
No, the debilitating is not normal. Right. Mild could be anything. Our uterus contracts as it's trying to get the blood out. So mild pains, we don't really, there's no cause for alarm for them.
And Doc, there are people with really heavy, completely heavy flow.
Yeah.
Others, the flow has lots of clots. What's the problem?
Yeah, that is also not normal. So if you're having very heavy flow, or if some people, well, they've had it for a while, but if it has changed that it's really heavy, then we start to wonder whether there are fibroids inside the uterus, whether there's something else called, again, adenomyosis, whether it could be also endometriosis. So if the flow is too heavy, you would need to see somebody about that. And sometimes, even if you're on family planning, it can cause some of these things. So you'd need to be evaluated and see what is the cause.
And for how long should normal periods last?
A normal period should last anything in the range of, some people for 2 to a week. Yeah, it shouldn't really pass a week. Yeah.
And Doc, you've talked about a week. And here we're talking about, okay, for people who go for more than a week, 2 weeks, and maybe you get to the 14th day of your ovulation and you're still having your menses, what happens?
There you would think there is a problem, because that is not really normal. There must be a hormonal issue affecting, because usually by the 7th day it is clear. Yeah.
And Esther is asking, can contraceptives cause infertility? I think it's a whole topic of discussion, but maybe you can just respond to what she's asking.
I would say no, and what they do, they cause you to have, they're temporary. So most contraceptives will ensure that you don't get pregnant when you don't want to get pregnant.
Right.
But in the long run, most of them are excreted from the body, and they really don't. There are some that take longer to excrete. So those ones we say cause a mild subfertility. So you have people who have taken some contraception and it's taking them 2-3 years, and we have to reboost their system. So it can cause some subfertility, some types, but I'd rather people take the contraception and use a condom and don't get abortions, which will make them, you know, then get infection and cause infertility in the long run.
All right, and Doc, as we wind up this first part of the show, maybe you could simply just highlight and emphasize once more the symptoms, the signals for infertility for both men and women.
Okay. The biggest thing is not able to conceive. So if you're not able to conceive within 1 year, you need to see somebody. Having irregular periods is not normal. You could get pregnant easily on your own, but for most people, if you have irregular periods, see your doctor, find out what the problem is, because there could be other issues, and get that sorted out. For the man, if you're having sexual dysfunction, or if you're worried that you only have one testis, then you also need to see a doctor.
And once again, speak to couples. For how long should a couple keep trying before they could even think of calling their doctor?
I will always say 1 year. Right. I think keep trying, and don't stress about it. I think we're stressing about it too much. If you have no problems, or you have no previous problems, and sorry, I'd like to also say, if you've had surgery, for women, if you've had surgery in the ovaries, you need to come a little bit early as well. But if you've really had no problem, and you have regular periods, your husband is okay, 1 year. Yeah, 1 year is good enough.
And lastly, let's say you've experienced some miscarriage with the previous pregnancy. Do you keep on trying, or should you first see a doctor?
One miscarriage, you can try again. Yeah, just be on your multivitamins. That's what I advise, and try on your own. But the minute you get pregnant, see your doctor.
Right, and Dr. Wanjiru Ndegwa, thank you so much for being part of this discussion today. And that's the end, or that's the time we had for this first part of my doctor show, but we've really learned a lot. And we're looking forward to having you again.
Thank you very much.
All right, and that's it for this first part of my doctor show. But remember, we still have a whole session where we'll be looking at your feedback. When we come back, we'll be having Dr. Alfred Murage, who will be taking us through some treatment options that we have for infertility. Do stay with us. Welcome back to this second and final part of my doctor show. And with me, we have Dr. Alfred Murage. We are talking about infertility, and this part we want to focus on infertility in men and most probably the solutions or the possible treatment that we have. Thank you so much for your feedback. I'm seeing your text messages coming. You could also be part of this discussion by calling us. Our call line is displayed right on your screen. My name is Purity Moseo. Doc, welcome to this show.
Thank you, Purity.
And thank you so much for having us or accepting to be part of this show.
Thank you.
Okay, Doc, I want us to focus on men. There are men who say that, you know, I have a baby somewhere, or maybe I have one kid with someone else, but this is not working, so it can't be me. What is the possibility of such people who have tried, and maybe they have one baby and they're trying to have another, but it's not working? Is it still a problem with fertility?
Yeah, that's a very good question.
Mm-hmm.
What would say is, if men have had children from a previous relationship, and they're not having another baby, they need to be evaluated, because things can change. Mm-hmm. Sperms could have been normal previously, and then in the course of time there could be changes. For example, there could be what we call obstruction to the channels that bring sperms out, or something else could have happened, maybe an infection. So if there was a previous pregnancy and a pregnancy is not happening in the course of time, it's very important that the men get assessed and they have a simple sperm test, and that will tell us straight away what's the issue.
Right, and let's just respond to Faith. She's asking, I have regular periods and I did sex after my menstrual cycle, which goes for 4 days. Can I get pregnant?
If it's immediately after the periods, over is unlikely, because ovulation will take place, like Dr. Wanjiru Ndegwa was saying, about day 14 or thereabouts.
Right.
So as soon as periods are finished, it's very soon, and the eggs are likely not to be mature. Yeah.
All right, and someone else is asking about, just before we get to men, someone else was asking about the pregnancy test kits. Are they accurate?
Yeah, the pregnancy test kits are very accurate, and if you follow the instructions on how to do the testing, it will either tell you it's positive or negative, and you can actually rely on the results. Yeah.
All right.
Yeah.
There was a question I had posed to Dr. Wanjiru on how well, because now you are a man and you are a fertility expert, how well do you convince a man that you know what, you're the problem and we need to do 1, 2, 3 changes on you so that this thing can work?
Yeah. I think we cannot emphasize enough that men should come to clinics accompanied by their women. And for men, it's very easy to assess them. All they need is to do a sperm test.
Right.
I know men sometimes will feel a bit uncomfortable giving a semen sample for analysis. But as soon as this sperm test is done, we immediately know if the sperm is normal or not. And if the test is normal, the matter is over. So then we concentrate our efforts on the woman. So it's no use doing so many tests on the women. We have no idea what's happening on the man. And as Dr. Wanjiru was saying again, it's not a single person's problem, it's a dual problem that we are talking about.
All right, and for both of you, you and Dr. Wanjiru, you emphasizing on sperm count for men. Is it the only problem? And if yes, how do you keep the sperm count up?
Now, what we know, men who are young and healthy are likely to have normal sperm counts. Men who are older, usually beyond the mid-40s and above, the sperm count will start to decline. Men who are overweight are likely to have abnormal sperms. Men who smoke, men who use other recreational drugs, and men who are not physically fit as well, and men who might have problems with sexual function. So all these things are pointers to problems with sperms, and such men should have a test sooner than later.
All right, and the issue of infertility for both men and women, is it genetical, is it maybe inherited, or what can we say? Because she was talking about subfertility, but there are people who completely cannot maybe get a child. So what is the origin of such problems?
Now, what we would want to say is the word infertility, by the nature of that word, it doesn't mean that it's absolute, and that's why some people would use the word subfertility. However, if you completely cannot have children, the word that is used is called sterility.
Right.
And that would mean either there are no ovaries for some reason, or women without a uterus, but they can have the pregnancy carried by somebody else, or men without who have not had their testes develop. So those are very few cases that you find. So majority of people who are infertile will actually have something that can be corrected, and it's a very small number who are completely sterile.
Right, and the people who maybe are infertile for women, do they have their periods, or what happens? Because they are a category of people who never get their periods.
Yeah.
Yes.
So anybody who doesn't have periods at all, they might have either a problem with their ovaries or a problem with the uterus. If it is the ovaries, it's likely that the ovaries have failed prematurely, and therefore they're not producing any eggs, and hence there's not going to be any periods. If it is something to do with the uterus, either it did develop normally, or maybe something has happened during, the lifespan that has affected the uterus in terms of function.
Right, and someone else is asking, hi doc, we have been married for 4 years and no child. I'm 25 and my husband is 38. We both have a child but from different partners. 6 years and 16 years respectively. Yeah, they have 6 years and 16 years babies. What could be the problem? Both of them have kids. This woman has a kid from a different partner. The guy has a kid from a different partner, but they have come together, no kid. What is the problem?
Now, as we said about men, things can change in the course of time. So when they had children with other partners, possibly their reproductive functions were working normally. And then in the course of time, something may have happened for either one of them or both of them. So the best thing for them is to both get evaluated and check what could have happened among the two of them or both of them, and then they possibly would have a solution.
Right.
But also depends on how long it's taken for them to be together, not have a child. So if it's only like less than a year and they're still very young, then possibly they need to wait longer.
Right, and someone else is asking for an explanation. Maybe when I have sex with my partner, there's always blood.
That should be considered as not normal. So if there's always blood after intercourse, then the best thing would be to have an evaluation and see what's happening on the vaginal walls and on the cervix.
Right.
Because there could be a bit of spotting occasionally after intercourse, but frank blood is unusual.
And Doc, what are some of the infertility tests that are available?
There's a barrage of tests that are available. What we normally want to do is, once we do the initial evaluation of both the man and the woman, would be then direct what tests are best to be done. For the ladies, we normally would sometimes do a test to confirm they are actually ovulating, despite having regular periods. Would then go ahead and check whether the tubes are actually open or blocked, and then do a scan that tells us whether the uterus looks normal, and if there's anything else within the pelvis that can interfere with conception.
Right, and Doc, yes, go
and
ahead.
then for the men, as I said already, basic sperm test. If the sperm tests are normal, period, they don't need another test. However, if the sperms were abnormal, then men can also have a hormone test done to work out why, and sometimes also imaging of the testes.
Right, and enough said of infertility, but now take us through the treatment options that are available for this problem.
Now, the first thing to work out is, does the couple require any treatment? If they're very young, well below 30, they haven't tried for more than a year, then it's worthwhile waiting slightly longer to either reach about a year, or sometimes even 1.5 years to 2 years. However, when you work out that there is something that needs to be treated, then what must be directed is what kind of treatment is required. For women where ovulation is not happening, all we need to do is give them tablets that enhance ovulation, and we expect that conception will happen somewhere between 3 to 6 months. If the tubes were blocked, then what we need to work out is it something we can correct by a surgical procedure, which usually doesn't work very well, or do they require what we call IVF, what is called as test tube babies?
Right.
Because that's the only way to address tubes that cannot really be repaired. For sperm problems,
Right.
mild problems with sperms, like mild abnormalities,
Right.
usually will self-correct by changing lifestyle. Men who are overweight just need to try and lose a bit of weight.
Right. And Doc, can I cut you short?
Yeah.
We receive a call from Anne. Okay. Hello, Anne. We've lost her, but I'm sure she's going to call back.
Okay.
You can-
So saying about men, if they're just mild changes on the sperms, so if there's adjustment of lifestyle, then that could change to normal. That means those who are overweight could be more physically active,
Right.
and then their sperms numbers could be better. Smokers, if they stop smoking, then their sperm numbers tend to improve. Things like Mira, other recreational drugs are also very toxic to sperms. So doing small things in lifestyle can help change the sperm numbers.
Right.
However, if there's very severe sperm abnormalities and doesn't appear to be anything corrective to be done, then the only way out is for them to have advanced fertility treatment, which involves IVF.
Right.
Yeah.
And Doc, still staying with men and women, what some of the health complications, diseases, and all that can contribute to infertility?
Yeah, these what we call chronic diseases, things like diabetes, things like problems with other hormones like thyroid hormones, they all have an interplay with reproductive systems, and that can contribute. So anybody with a chronic illness is best if it's optimized in terms of control, and then the effect on the reproductive system is less. Infectious diseases, which were already mentioned, are like sexual infections, TB, HIV. All these things have a knock-on effect on fertility, and people who get like STIs, for example, they should be treated as soon as they are diagnosed to reduce the problem that they would have a knock-on effect on future reproduction. The best way is actually prevention, like was said earlier. Use of condoms and trying to have steady relationships,
Right.
and then that will prevent people from getting exposed.
Right.
Yeah,
And Doc, do we have any relationship between stress and subfertility?
Yeah, that's a tricky one, but we know anything that interferes with your psychological function
Right.
can have a knock-on effect on sexual function, can have a knock-on effect on ovulation, can have a knock-on effect on sperm production. So you're very right, psychiatric problems, depression, any psychological disturbance can actually contribute.
Right, and there's always a relationship, like you had said before, between infertility and diabetes. So my question is, does it improve the fertility when you try to cut your weight?
Yes. People who are overweight, if we look at men, for example, if you take two men, one is completely overweight and the other one is normal weight, and you look at their sperm numbers over a period of time, the overweight person will have less sperm quality. For women who are overweight ovulate less, and they have poorer quality of eggs.
Right.
And equally, if they get pregnant, they have poorer pregnancy outcomes.
Right.
So yes, optimizing weight is very critical.
Right, and,
Yeah.
and Doc, there's a confusion here. There's a notion that when you want maybe to get twins, you have to check on your diet, and this means healthy food. And so when you talk about healthy and staying healthy, does it mean that there are a category of people in terms of their weight that can get twins, and there are others, for example, if you are underweight, do we have some complications, or do we have challenges that come when you're trying to get a kid?
Yeah. Now, the first thing to say is we would rather people have one baby at a time. A single baby, better pregnancy in terms of the way the pregnancy goes, and in terms of complications and even delivery. However, there is no relationship between being a bit overweight or underweight and actually conceiving twins.
Right.
It's sort of a random event, and most of it tends to run in families.
Right.
However, because of use of fertility medication.
Right,
some
and
of-
Doc, kindly just allow me to cut
Yes.
you short.
Yeah.
Anne is back.
Okay.
Hello, Anne.
Hello,
Yes, hello, how are you?
I'm fine.
Okay, talk to us, please.
Nilikuwa nasema inakaa kama sijaona periods zangu
Okay,
for almost saa zingine nakuja once a year,
okay,
na nikienda period
okay.
na nikienda period sasa na period na kuja na meza pills.
Okay.
So nikimeza pills na inakuja, nikiacha pills inapotea.
Okay.
And sometimes I had pain and some redot down there. So I don't know what's happening.
Okay,
And
okay, thank you. You've had Anne.
Yeah,
She's talking about she never has her periods unless she takes some pills. Yeah. What could be the problem?
Yeah, we didn't get what her age was. However, she sounds a young person. Yeah. So it's likely she possibly has what we'd call hormonal imbalance. You know, like it was alluded to earlier, like polycystic ovarian syndrome,
Right.
where periods can disappear for even a year. The other unlikely thing may be her ovaries are not functioning normally, which we'll call premature ovarian dysfunction.
Right.
So what I would suggest to her, if she gets to see her gynecologist, then she'll have an evaluation, and then they will be able to pinpoint why her periods are not coming.
Okay.
In terms of what she said, she has some bit of ulceration. I
Yes.
think that also needs to be checked.
Investigated.
Yeah, yeah.
Okay, and I think that's the same question Rachel from Nairobi had. She's talking about my last periods were the first week of January. Until now, I haven't. What is the issue?
Yeah.
The same explanation?
It would be the same explanation, but if her periods were regular previously, she needs to check she's not pregnant.
Right.
Yeah.
And we have, hi doctor, my periods are of 34 cycle. Is it regular or irregular, or when do I know that I'm ovulating for 34?
Yeah. Now, periods that are below 35 days, those people tend to ovulate. And like Dr. Tego was trying to explain, if she works backwards, usually about 2 weeks before the period. However, if the period becomes longer and longer below 35,
Yes.
then likely she's not having regular
And
ovulation.
Doc, interestingly, we have a guy who is calling
Okay.
from
Oh, that's good.
Naivasha.
That's
Maybe
good.
we could get to hear what he's
Yeah,
saying.
that's good. Yeah.
Hello, Mark.
Hello,
Yes, Mark. How are you?
I'm fine, thank you.
Yes, talk to us.
Nilikuwa nauliza mayofa akipata pedi zake zinakuanga ndogo sana,
Yes.
alafu sometimes maybe mpaka anasikia maumivu,
Yes, Mark.
alafu maybe in case maybe anasema maybe when we are together nasikia uchungu sana.
Doc, can you hear Mark? Mark, maybe you can try to reduce the volume of your TV for clarity. Hello, Mark? Mark? I think he's going to call back.
Anasema maybe zinakuja zikiwa kidogo sana,
Yeah.
alafu sometimes zinachange sana. Nakuja ni kama blackish.
Yes.
And sometimes maybe tukiwa pamoja nasikia uchungu sana. Is that a problem?
Doc, you've heard Mark.
I didn't quite hear what he was saying, but I felt like he meant the periods are very light.
Yes.
If I got it right.
Yeah.
Well, light periods is not usually a problem.
Okay.
Especially if they are light and they last, the normal amount of days.
Okay.
Somewhere between 2 to about days to about a week, or even 3 days. However, if they are very light and it's something new, then it's best if the lady got evaluated. Yeah. I was kind of hoping he was going to ask something about men.
Maybe he was
yes.
asking on behalf of his
Yes,
wife?
yeah,
Okay.
yeah.
And back to the treatment options for infertility, Doc. Yes. You are concluding on something?
Yeah. I think I was at the point of saying men who have very severe sperm abnormalities, unfortunately, most of the times we won't give them, a good reason why that's the case. And majority of the time it's something that is not correctable, so you can't correct that. And the only way out for these men is having advanced fertility treatment with, what we call IVF. So the help is out there for them. And even men where there's no sperms at all in their semen, all they need is a proper evaluation. And by doing their hormone test and imaging of their testes would be able to work out whether we can actually get sperms directly from the testes for them. And most of them can have their own children with advanced fertility treatment.
Okay.
So there is, treatment for every scenario, and only a very small minority where, they would have any treatment. Yeah.
Right.
Yeah.
And Doc, what is the explanation for a person who's never, maybe they are of age, but they have never had their period since they were born?
There's a high likelihood that that's something genetic. Then the genetics, there's a lot of variations in terms of the way genetics can explain failure to have a period from the word go. And what normally we do is these girls would come to us around about the late teenage,
Right.
or in the early 20s. And after doing basic evaluations, then we might sometimes do their genetic studies and sometimes we might find that they have abnormal genetic makeup, which is not normal for women. For example, they might have an extra, a missing chromosome,
Right.
or an extra one, which is for males,
Right.
or even they don't actually have the female chromosomes as well.
Right.
So there could be a lot of developmental things that can explain it, and it's very difficult for these women getting to a diagnosis and then working out how to help with their reproduction.
Right.
Yeah.
And someone is asking, hello, Doc, I and my wife had intercourse after her periods ended, and after that, and after 1 week, she had another period. Is there something wrong?
It's we call it transient change in the way the hormones work.
Right.
So if a period has come which was normal, then another one comes shortly after and unexpectedly, and is not the usual pattern, then it's likely something that is transient, a change in their hormones for that cycle, and then the next cycle should just be normal.
Right.
So I wouldn't worry if it's happened once or twice. We only get concerned if it's something very consistent.
Right.
Yeah.
Someone else, kindly ask Daktari if masturbation interferes with sperm quality.
No, it doesn't.
What does it interfere with?
It doesn't. It might, interfere with relationships,
Okay.
intersex relationships. However, in terms of, sperm numbers and quality, it shouldn't really affect that.
All right.
Unless, of course, there's linkage with use of other things like, drugs and what have you. But generally speaking, itself as a practice shouldn't interfere.
Right.
Yeah. Yeah.
Doc, lastly, the issue of surrogacy. When do a couple maybe choose or decide, I think it's now time for us to consider surrogacy?
Okay. Now, for the sake of listeners, surrogacy means somebody else carrying a pregnancy for another one.
Yes.
Now, the only good absolute reason for that to happen is if the person who wants to have a surrogate doesn't have a uterus for some reason, or their uterus is not functional, has become abnormal for whatever reason. Because surrogacy can be abused by people wanting to maintain their body structures by not carrying a pregnancy and saying, oh, we're going to rent a uterus from somebody else. So there's very few medical reasons for surrogacy, but there's increasing social reasons where some women don't want to carry a pregnancy and they want somebody else to carry it for them.
Right.
So I would say if anybody is getting into it, they need to really think why, and if it's not for a medical reason, then they need really to think again.
Right.
Yeah.
And very quickly, someone else is asking, hi, Ebru TV, I'm Joy from Meru. Can P2 cause infertility?
No.
Okay.
Nope.
Completely no?
It shouldn't. However, we advise people who are noticing they're using these emergency pills so often, what they should want to do is go on a longer term contraceptive rather than using the P2s every cycle.
Okay,
Yeah,
and lastly, someone is asking, what are the best foods for a man? And let me ask for women as well,
Right.
that can boost fertility.
Yes. Now, the best way to answer that is to say, if you're eating healthy, that means you're having a mix of foods, good carbohydrates. We're talking of, non-refined carbohydrates.
Okay.
Lots of veggies, lots of fruits, lots of water, and combining that with physical activity, and this is for both men and women, then likely you're having a balance of all the micronutrients you require, both for your well-being and for fertility. However, on the other extreme now would be, what we call junk food, a lot of fries, lots of red meat, and lots of refined carbohydrates. So that tends to give you the right, the wrong micronutrients,
Right.
and then you get a bit of deficiencies.
Right.
So if people are able to work out a healthy, balanced diet, combine that with physical activity, then they should be fine.
Okay.
Yeah,
So-
and there's no real reason to be taking so many supplements.
Okay,
Yeah,
so
yeah.
basically it's healthy lifestyle if it's a couple that is planning to settle down with kids, children and all that.
Yeah,
Thank
yeah.
you so much, Dr.
Yeah.
Alfred Murage, for
Thank you
making
very
time for
much.
us.
Yeah,
That's
yeah.
all the time we had for the show today, but
Okay.
it was
Yeah.
really educative.
Right.
We look forward to having you again.
Thank you.
Yes,
Yeah,
and thank
thanks.
you all for watching. Thank you for your calls. Thank you for your SMSs. Every Wednesday, we will be continuing with this discussion on pregnancy and the factors or the conditions that come with, or the complications that come with pregnancy. I'll see you again next week from Monday to Wednesday, 10 a.m. to 11 a.m. You could always watch the previous episodes from our YouTube channel, Ebru TV. My name is Purity Museo. Do enjoy the rest of your day.